I'm June Sugiyama, Director of Vodafone Americas Foundation. Vodafone is an international telecom company. We have 28 foundations worldwide, and in the United States, I run the foundation to support organizations like YTH that uses technology to achieve their goals, and that's why I'm here. So before we start and introduce you to the fantastic panelists that we have here, I just wanted to take a poll with all of you who are doing great work. Who has data in their work right now? Who has data?
Everybody.
Okay. And then who's already doing something with the data? Pretty good. Okay, and who's here because you have data, but you want to find out what to do with the data? Okay, so kind of
we'll talk after.
kind of shows you kind of shows you, you know, what the lay of the land is. So, you know, data can mean lots of things, and as Nancy was just talking about, it really doesn't mean much if you don't lead it back to the people you're helping and you're serving. And it really doesn't mean much unless you make it mean something. So, you know, and there's lots of ways to look at data. So I wanted to show you an example here. So does anybody know what this is? Okay. It looks like an aquarium picture. But actually, I've tricked you guys. It looks like kind of a surreal aquarium picture. So it's really a map, a world map of HIV prevalence. So with one snapshot, you can actually tell a whole story. And you can base your work on it as well. So today, we have some experts in the audience here. They're going to come up and introduce their work and their areas of expertise, but I'm going to briefly introduce each one of them. We have Lynwood Bishop. Lynwood is the president of MapLarge. Is that correct?
Yes.
MapLarge. And Tom Coggia. Tom is the president and founder of IconAtomic. And Michelle Hamilton Page. She's a social and mobile media manager at the Knowledge and Innovation Support Unit at the Center for Addiction and Mental Health. And then we have Jacob Solomon, who's a good friend of mine now. Jacob is a policy analyst and project manager from Oakland. Most recently, he was at 2013 Code for America. He was a fellow there. And then we have Will Yu. Will is the director at the Foundation for Healthcare Innovation. He joined the San Francisco Civic Innovation Office in mid-2012. So I'm going to have each of them come up for about 5 minutes, give you an intro and also about their experience with data. So first, if I can bring Lynwood Bishop up.
Oh, you got it for me? Great. Or I could... Don't touch it. I was going to say, so while we're warming this up, I've got a 1.5-year-old and a 4-year-old, and I can definitely say that those baby messages, it's like baby Siri that you guys have going on. You're like, hello, Siri. You're like, hey, baby. And they're like, yeah. Definitely
Can you sign up your boyfriend by like entering their phone number or something?
Yeah, in fact, now we built a viral hook that you can have someone else babysit your text baby for a 3-hour period.
That's awesome. It's 6 a.m., right? Will they get them and they feed them and change the
actually,
diaper?
it's in the afternoon. If you have to go to class, it's while you're in class, someone can
Okay.
babysit it for but only a 3-hour period.
It's like those little things you used to like shake and say, you know, anyway. All right.
Don't shake your baby.
So yeah, don't shake the baby.
PSA.
So what we do, MapLarge, I'm the data shop here, the big data kind of guy. We take data that all of you are creating in all of these wonderful, super fantastic programs, and we help you get your message out there. So we deal with nonprofits and NGOs, and then government organizations. To commercial organizations that have lots of big data. And the talk I'm going to deal with today has to do with one sort of snippet of this. But just to put up this graphic for a minute to help you think about what it is that you have, and what we do is that we take sort of your data as it comes in. Some of those are the different types, and then we help you make products out of those pretty quickly. And it ranges anywhere from June. We have large amounts of cell phone data that we use for doing analytics that are all privacy sensitive but help do good things you can ask me about later. And all the way to like CNN, where we took like census data for them and helped create some infographics. And so I'll move into a particular thing. But the focus of the message today, I think, is how to spread your message, right? You've all collected this data, and it's kind of your baby, right? And you've been working it for a long time, and this is, you kind of want to tell this story. And what I would propose to you is to think about looking inside of your data and thinking about, how do I get this message out? How do I apply it to a couple of different audiences? So so you can grow your stakeholders. You can grow the people who are using your data. You can grow the people who are funding your data and your programs, and just helping you think in that line of thinking. So we've taken a couple of our different initiatives. We've sort of taken them all the way through to some bigger name type of press organizations that we've made the front page of. Say, for example, like the Huffington Post. And it's, how do you capture that PR, that press person, that blog writer with something very interesting, something tangible that they can hold on to and write a unique story about, and giving them the fodder for that. And so what I want you to do is, like, in your mind's eye, put your hat on. If I were a blogger who had never heard about your fantastic project before, how are you going to shape your story to get them to write about it? Because at the end of the day, what you're really doing is increasing your reach, increasing the users, and increasing the stakeholders who are contributing to your cause. So one of our projects that many of you here are familiar with, but not necessarily everybody, is a project called AIDSview. And this is that HIV prevalence data that June had worldwide, but in the US. And what we started with, this is what we created for them. But up into this time, this was sort of the map, right, of like a state level view. And what I would kind of refer to this as like the old way of mapping. It's just a big giant, public health data, but we're only going to tell it to you on a level where you can't really do anything with it, right? And what everybody here I've found is doing is that they have a nice little community that they've reached into. They're touching people, right? And people are very granular. And it may be tens of thousands of texts across the nation or potentially the world. And what you start to need to do is observe the very tight patterns in that data, because that's where the real answers are. That's where you really find how to make a difference. And so what we did was bring it back to, for this particular data set, the best we could do is initially was counties. And it really started to paint a different picture of the map. It's much more detailed and much more interesting. And so each year, I think AIDSview has been going on for a good amount of years now. And Tom and I actually worked on this originally. Is that we started reaching out to an audience. This year, it's going to be, XYZ audience, and this is the story that we're going to tell them. But next year, we need to add something new, something different, something to get the press involved, the people, the stakeholders involved, creating a new conversation and keeping this train moving, so to speak, and helping it grow. And so I think here's an example of where we brought in going from HIV prevalence data. Now we're saying, well, what if there's some link? We don't know exactly what the link is, and there's a lot of PhDs that work on this and write real papers and things. That's not our ballywig. But what if we bring in external data to say, like, what's the percentage of people that had a high school education? Does that correlate with the HIV prevalence? And what we found is by exposing these tools to people, all these different data sets, external data sets. So don't just think about your data. What external data can help my data, help other people, we started leveraging the community. I've heard several people tell me, oh yeah, I use AIDSview. And I'm like, how? Tell me. It's such an interesting story, because once you expose all the different external data sets to people, then they're able to bring their own vision onto this project. And so external data sets, we started now even going deeper and really focusing on city level data to allow people to really expose, like I said, those really tight patterns. And so if you do have data and you can expose it to others, I say that's really empowering them. And the way that you can really get that out there and help people understand is to just create those really unique stories, create a story that helps tell it to a particular audience that you're trying to capture. And so look at your data through that lens about how you can share it with others. So to wrap up my short presentation here is think about what's timely today in your data that you can make an interesting story about, what's captivating about it, and what's new. And that's what really creates a newsworthy story and allows you to kind of get your message out about what it is that you have to offer, to your communities. Thanks.
Next we have Tom Coggia from IconAtomic.
Boom. Okay. So yeah, my name is Tom Coggia, and I'm on the visual design side of this. I'm not a data collector, but I do work on projects where we visualize that data to try to make it useful. Oops. And so I want to talk about something that's really interesting to me, and that's the idea of the quantified self, which you may have heard of. It's defined as a movement to incorporate technology into data acquisition on aspects of a person's daily life. And basically, there's been this explosion in portable technology that's connected, so we can document all these different aspects of our lives, like down to minute detail. We can collect all kinds of data on a really personal level, and that's kind of new, and I find that really exciting. So I wanted to talk about what I think the ramifications are from that, or what my hopes are for that. I need to stop walking away from that. So in a nutshell, the quantified self is all about you. But before I got into that, I first just wanted to tell you, I got a puppy. That's Olive. She's the big dog. That's Phoebe, her new best friend. So, look at puppies.
Yeah.
Okay. So, the quantified self, it's all about you. So, what I find interesting is this shift from, and Lynwood mentioned too, you've got like this really large data set. Well, how do you apply that? How do people apply that to their lives, their daily lives? And so what I'm interested in is the shift from the population to the personal, to be able to collect and visualize data on a population level for starters, but also drill down and talk about personal data. So there's all kinds of devices out there now to help us do this, right? You've seen all sorts of trackers. You wear them on your wrist, you clip them on your belt, and it collects data. It turns it into a cute little dashboard. And there's all kinds of them. This is Fitbit, and they've got this promo where they talk about, you wear this device and it creates this real-time digital dashboard with all this information about you, and creates this sort of dashboard, which is really well done. It's really interesting, and it makes it look like there's a lot more data than there is there. But there is data there. It's really just footsteps. But there are other devices too. So there's this scale that you step on, and it measures your weight, and it's wired, so it sends it to your account, and you have this detailed account of your weight over time. That's interesting. This scale actually does a little bit more than that. It measures your heart rate and does an indoor air quality monitoring sort of thing, I guess. It says it does. So that's more data. There's more data too. There's things like this scale now that you put food that you eat on it, and you tell it what you're eating, and it gives you all this detailed information about what you're eating. I should probably talk on this. But in a way, this is a smaller example of this larger shift I'm interested in, which is from the population to the personal level. Typically, when you record your food diary, you would tell it that you ate an apple, and it would say, oh yeah, well, apples generally have about this many calories in them. But in this case, you're actually saying, no, I'm eating this apple that weighs this much, and I'm eating it, so that's how much I'm eating. You've got Facebook check-ins, you've got apps like this that periodically pop up on your phone and say, hey, what are you doing, and who are you with, and what are you eating? And you can turn that into visualized data like this. And the point is, we're collecting all of this data. You can take a picture of yourself every day, and you can document your beard growing like this guy. there's flexible electronics that have sensors in them, batteries and radios that can transmit your pulse rate and all this kind of stuff. You've got 23andMe. You can send them some spit. They'll send you back this neat little diagram that tells you where your ancestry is from. And it'll tell you, like, this guy's super white. He's 99.3% European. So the thing that I'm interested in is now that we have all this data, like now what? Like, how do we make it useful? And that's what I'm really interested in doing. And so then I'm interested in the next step, going from population to personalization, or to personal, and going from visualizing this data and actualizing it. So that's what we're all interested in, right? We want to know, how do we help people not just visualize this data, but actually change their behaviors based on that data, make positive changes in their life because they're getting this data? And, 23andMe got into a little bit of trouble because they were telling people, well, you might get Huntington's disease, FYI. It was just, they would tell them that, and they got into trouble because they were giving medical advice. Other devices like this, and this is where it starts to get useful to me. So this is a companion to the scale. It measures your blood pressure, and then you can look at this view and say, oh, well, look, I can see the relationship between my weight and my blood pressure. So if you've got somebody who has high blood pressure and is overweight, they can see how changes in their weight can affect their blood pressure, and hopefully that will encourage them to change, to make those kinds of changes. So what I want to wrap up is, this is a chart I did that shows HIV diagnosis. This is where new cases are occurring around the world and in what populations. And it's a super high level. It's by country. So it's not terribly useful for an individual. As a policymaker, you could look at this and say, well, maybe we should look at what we shouldn't look at what they're doing for IDU users because a lot of them are contracting HIV. So it's helpful for that. Drill down a little bit more, you've got like AIDS view, which goes by county, which is better because you can start to see, I live in a county where there's a higher prevalence of HIV, but that's only so useful. So what we did in this project quickly is we asked them questions about their sexual behaviors, their demographics, and presented them a score which compared their answers to population level statistics and gave them an idea of how at risk they were for contracting HIV. And then what we allowed them to do was to change their answers prospectively for the next 3 months and say, okay, well, what if I reduce the number of partners, or what if I stop using crystal meth? The needle would physically move real time, and they could see how their change in their behaviors might actually change their risk. And so that's an example, I think, of how we can take this data and present it to people in a way that they can actually do something with it and say, wow, if I stop using crystal meth, I can drop my risk, by 10 or 20%. So that's what I'd like to see when there's this shift towards getting all this data and what we do with it. And I think projects like this are one way that we can do it. That's it. Thank you.
Okay, we have Michelle Hamilton-Page from the Center of Addiction and Mental Health.
So yeah, I'm bringing this sort of, Deb, I'm bringing this sort of so what to what are we doing with data to this, and I'm only going to take 5 minutes and just sort of dip into this. We're 3 months into a project. I work at a hospital in Canada, in Toronto. We're in the province of Ontario. That's like a state. Thank you. So I work at a hospital, but I'm a public servant because we have socialized medicine. So what we're trying to do is we're trying to take a bunch of data that one of the crisis lines in Canada and another health organization has pulled together about where there are right now for us 4,000 data points for services for students. And we've gotten together with partnered with 3 different universities, the Art and Design University, the University of Toronto, the Faculty of Medicine there, and with designers and programmers at Ryerson University. And we've said, okay, here's the data points. We're going to use an open crowdsourced map done by Ushahidi called CrowdMap. And my staff at the hospital will work with you to get that data to put up in MySQL and a CrowdMap. And from there, this is your project. So we're 3 months into it. And so what really matters for us is that we're talking with students to say, okay, so if I asked you to visualize health and wellness for you, taking into account things like the social determinants of health, which you see there, so gender, culture, education, socioeconomic background, and so on and so forth, and how that has impacted your health, and how you're finding health, and how you're mapping your pathway to health. What would that look like on an open source map? How would you map that? What would the taxonomy look like? What would it look like for you? So by the students, for the students, we've gotten them together. We have a board of directors of about 22 students from those organizations or those institutions, and they will take that crowdsourced map and they will make it, we don't know what yet. But what we know will happen is that they will start to construct a 3D sort of visualization for us of how they experience health on campus, outside of campus. Maybe it's sexual health clinics, maybe it's the food bank, maybe it's legal aid around my immigration status. Again, if we think and we look and try to visualize our own pathways to health and what we're doing, and ask someone to do that, and then take data, map those points, and then break it up and make it real. Maybe that involves going to those clinics. Maybe it involves thumbs up, thumbs down. One of the things that the CrowdMap platform can do is it can actually scrape social media. So while we can have reports that are the data points, we can also have participatory mappers walk into those clinics and say, I had a really bad experience as this big butch dyke asking for a pap smear. Or no one asked me if I wanted one because they didn't realize that I had a vagina. Nancy, you're so buying me a beer after this. So that's one of the things we want to see happen. We want to see people take the data, crunch it up, do what they want to do with it. We'll work with students who are in 3D design. We'll work with students who will hack that map and attach things to it. And we will support them to get it done. And when, in the end, we'll come up with some kind of a visualization of how, in the now, students in the city of Toronto and then across Ontario are experiencing health and wellness and what their pathway is, where the gaps in services are, and so on and so forth. In the second year, which is coming up now very rapidly, what we'll do is we're going to have a hack for health. So we're going to bring those folks together from those institutions and say, great, here's the map. It's open source. We are going to support you with the money behind this project to have you take it and crack it open and do something really interesting with it. We don't know what that's going to be, and we're okay with that. And then in the last piece, it's around curating knowledge. So it's a great participatory experience for those people that are involved in it. We're going to be making sure that we go onto campus and connect with groups that may want to take this over, and from year to year from now on, start doing a hack for health, so that as we can scrape social media, not only do we have the data and the points, but we have instant reports of what my experience is with those organizations. So then the so what comes back. We were talking at lunch today. So how do we close the gap? How do we make sure that those organizations hear what student experiences of the health and wellness services that they're offering? And so that becomes part of my work as someone who works at an institution that supports participatory mapping, that supports taking data and bringing it to the now and the individual and making it real and keeping that alive. So part of our job is going to be to pave the way with those organizations to take that feedback and figure out what to do with it. To be open to hearing that, your service actually sucks for transsexual students. And here's why. And to create those linkages back to the stakeholders who are giving you all that data, who are providing you that data, and actually paving the way for some really good feedback back and forth. So we're only 3 months into it. We've got great funding behind it. Hopefully we'll be back next year or the year after, whenever we get it up, and it'll be done by the end of this year. And you'll either hear about it online, or you can follow us on Twitter or anything else and see what's going on. How am I doing? I think that's good. That's it. That's all I've got. I'm out.
Hello, everyone. My name is Will. Okay, good to see some familiar faces. In a former life, I used to work with the Department of Health and Human Services in Washington, D.C., and I really joined the administration at the start after the Senate had won the general election in 2008. And I didn't know, I wasn't cut out to be a public servant, but one of the tasks that I had, that I was charged with as an appointee, was to help encourage innovation in healthcare, health IT, and health data. And if you had told me that this type of meeting with this type of audience was possible even half a decade ago, I would have been shocked, okay? Because we've really come a long way as a country in terms of the level of enthusiasm and channeling the level of activity that's taking place. Now I'm back in the San Francisco area. I've started up a nonprofit organization called the Foundation for Healthcare Innovation to help encourage and disseminate some of these worthwhile projects. But I'm also part of a startup that's dedicated towards visualization in big data. And I'll talk a little bit about that and why it flows into some of the things that you all are interested in. Okay? So Lumiata, okay, it's really an organization to bring the best of medical science available through an API. What we've done is take thousands and thousands of data sets, created a database of over 660 million different data points and brought it all together. And here is actually a cool little visualization of what we've done. This is actually a representation of all the diagnoses that are possible for an individual. 4,300 acute diagnoses, okay, chronic diagnoses, combined and showed how they relate to one another, okay? Really cool representation of how far medical science has come over the last few millennia, okay? And my purpose in showing this to you is really how visualization can take a large body of data, large corpus of information, and really boil it down to a single visual to create a compelling story, okay? In the beginning, we raised our hands and we said, you know, who has data? All these new data streams that are being built at the federal, state, and local level, okay? And the mantra for a lot of folks in the field was, let's liberate the data. Let's get all that data together and make it accessible, okay? And my charge to you all as innovators, as folks who are passionate about initiating change in healthcare is how are you going to liberate the story, okay? That data set, here's another representation, heart diseases on the left-hand side, in case anyone was wondering, for all those data points flowing into the left-hand side, is how are you going to tell a compelling story, a compelling, I guess, argument, okay, in a relevant context that will resonate with people to initiate change. I think that's the theme that we've heard from all the panelists here today is they're all engaged on a journey to help liberate that story, okay? I'll offer some perspective on how one might do that to have a maximum impact, okay? So our philosophy was that Google, Facebook, and other technology organizations that had created what are called graph databases, or ways of organizing that information can be applied to healthcare. And that's really, you know, not relevant to the topic, but I just want to give you a little bit of context. We've taken diagnoses, symptoms, therapies, medications, labs, et cetera, and tied it into a single medical graph so that all that raw data flows into a single source and then can be applied to an individual, okay? And that's really a very specific example of how data can flow to a single person, okay? So what we try to do is make our work relevant to medical science. It really holds very closely to how medicine is practiced. And we also have a strong data science analysis as well, so that when that information comes forth, we can give visualizations like this. You have visualizations like this. This is a patient story where all the information at a hospital system, okay, or a health payer boils down to a single page so that the clinician can see where one is and what one's context is, okay, with regards to their health. And it would be awesome to be able to pull in new data sources such as weather, such as those quantitative data streams that was mentioned earlier, okay. So the entire point of all of these efforts to distill these disparate data sets is to boil it down to a meaningful place where a story can be told and action can be initiated. And if you are on that journey, if you are trying to initiate change or enact change by getting this, I urge you to look at your data through 3 different lenses. One, it has to be true to medical science, okay? While you may be very passionate about changing your environment and helping to initiate new policies, there is a very powerful, a very large set of institutions that are grounded in medicine, okay, in science, and they behave in very specific ways. If you do an analysis on your own and you are able to correlate your health with, I don't know, the success of your favorite sports team, for instance, that does not hold up in a scientific fashion, and it's not going to be accepted by your care provider. Or from a population health perspective, how is that going to be accepted by policymakers? So it has to be grounded in scientific fashion, okay? The second part is looking at it through a data science lens, okay? You all, I'm sure, have heard that correlation does not equal causation. Looking at the different relationships that exist within your data and seeing what is appropriate when you put it onto a visual stream. Okay, how does this make sense? Is this an appropriate context of that one might look through as a statistician? Okay, I know this is not necessarily the first thing that you think of when making a compelling story, but these, I guess, aspects of visualization need to be in place in order for you to make sense, and in order for your story to have a life beyond the initial, wow, this is wonderful, okay? And then finally, looking at through a cultural lens, and I'm sure that this has been talked about quite a bit, but I can't emphasize this enough. We see, when I was in government and I was funding a lot of innovative projects, we had a lot of passionate people who came to us and said, we would like public funding because we are very passionate about changing the way, I guess, health is perceived in this country. And they would have these wonderful apps and tools, but they didn't take into account the cultural aspects of the end users. Okay, and I give a great example of this is someone who wanted to build an app around, interactions with their primary care provider, and said, we're going to build an app that links you, your family, and all your, I guess, closest confidants around your health. And when you go to your primary care physician and they have an update for you, that's going to be immediately sent out to all of your social network. Okay, and they said they wanted to fund this, and I thought that's a great idea, but what is the likelihood that that's actually going to take place? Okay, look at it through a cultural lens, and what is the viability of your idea? So I know we're running short on time, but looking at it through a cultural lens, data science, and medical science. And really these three perspectives will help propagate your idea once you're able to find that compelling hook and align it with your end audience. So I urge you to consider that as you're beginning to dazzle us with wonderful visualizations. My organization has actually sponsored a yearly challenge with some of the folks in Washington, D.C. called the Beauty of Health Data. Okay, the entries are actually complete for this year, but I encourage you, if you're building something wonderful that needs to be shared, need to be disseminated with other folks, to actually submit it to our website. It's free to enter, and we have some wonderful prizes to encourage participation. It's called the beautyofhealthdata.org, and we believe that by bringing a lot of different folks together, by exposing them to data streams and applying their innovative, creative ideas, we can liberate the story and really, help to improve health at an individual and population level. Thank you.
Thank you, Will. We have Jacob Solomon.
Hey, y'all. First, I want to address an important question that Michelle asked. Where are all the lesbians? Michelle, I have 3 moms. They all live in Berkeley. One of them is single.
Berkeley.
They all have tons of lesbian friends.
In Berkeley?
In Berkeley.
Okay, I'm in the wrong town.
Yeah, we can go over there later. And I want to do a really quick 30-second survey. Who works in government? Just raise your hand. Cool. Who works in like a direct service provider or nonprofit? Who works directly with youth? Who's a designer? Graphic designer, UX designer. Cool. Who's a developer? Woo! There's only like 4. That's why your salaries are so high. It's good to know. Can I switch it to this screen? Sweet. I'm gonna cut my talk in half because we're short on time. So ignore these. So I was a Code for America fellow last year. Code for America, it's a nonprofit organization. The goal is to basically support innovation in local government. So I worked with the city of San Francisco last year, the Human Service Agency, and we were tasked to make things better. That was it. So we started trying to figure out how to make things better. The first way we started was, my background is I was at a company called Palantir Technologies, which is big data analysis platform, and then I was at the RAND Corporation, which is smaller data but research data, so it's mostly like big randomized control trials. So naturally, when we're trying to figure out a way to help, we turn to data first. So these were the kinds of things we looked at. I know it's a little bit too small to see, but these are participation rates by state in the country for CalFresh, which is California's brand of the food stamps program. The important takeaway here is that California is literally the worst. We are literally the worst state. So about 50%, this was in 2010, about 50% of individuals who are likely eligible for CalFresh were receiving it in California. So this is great. But on day 1 of our fellowship, we walked to 1235 Mission Street, which is the main food stamps office in the city. And we walked through a barbed wire fence. We walked down a concrete ramp. We walked through a metal detector with 2 security guards on both sides. We walked into the main lobby area. There was a long line leading to a big wooden counter. There was bulletproof glass going from the counter to the ceiling. The city staff, the city worker, was sitting behind the bulletproof glass. The client walked up to the counter speaking through a microphone kind of like this that was mounted on the glass. I talked for maybe 5 or 10 minutes. It was a really tall man, so he was kind of hunching over. He tried to pull the microphone up to his face, but the neck was too short, so he kind of was leaning over. And he eventually got on his knees and rested his elbows on the countertop, and that was how he finished his conversation with the worker. So that's the nature of the problem that I think we are actually, at Code for America, we were tasked to deal with. This kind of visualization didn't help us understand that problem. So we ended up taking a very different approach. We were trying to get at questions like this: how can we make things better? How do people enroll? What's it like? What's the worst part? What's the best part? How do people use the benefits? Does the cashier know that they're using food stamps? What is that like? Do they care? So we wanted to get to these kinds of human questions. So we enrolled ourselves and went through the full client experience. And I want to show you a couple ways that we use general tools at our disposal to just document and describe this process. It's not exactly data-driven, but it's experience-driven. So if you apply for CalFresh online today in most of California, or about 18 of the larger counties, this is the process. So this is a little walkthrough I put together. I know I'm going to go through it quickly. There's about 120 screens here.
Wow.
There's one that I want to call out, which is this one. So this page asks if you're a felon. It asks if you're a drug felon. And my favorite question, it says, have you or any member of your household been found guilty of trading SNAP benefits for guns, ammunition, or explosives after September 22nd, 1996? Once you're enrolled, so we're 42% of the way, you can see. So after you're enrolled in food stamps, we started getting letters like this. The very first letter I got was in Chinese. Here's a timeline on the bottom. We were terminated, our case was terminated 3 separate times within the 7 months of our fellowship.
For what reasons?
Various reasons. Yeah, that was the first one, actually. I missed that appointment. Who knew? Here's a really interesting one. It says, effective October 1st, your food stamps benefits are changed from $200 a month to $200 a month. Here's why, and then it tells us about our utility bills, which have not changed. So after about 3 months of that kind of research and documentation, the only thing we did was send like one text message to people. So we found out in this process of talking to clients and just documenting our own experience that there's about 2,000 cases that are discontinued in a given month in San Francisco. We think about half of them don't know until they're at the grocery store with their cart checking out, and then it's the moment they scan their card that they're told, oh yeah, the county discontinued your food stamps. So we spent a full year trying to just send people text messages before that happened. There was many barriers. There was policy barriers. We were the first human service agency in the country, we think, to send text messages legally, at least. We had to work with the city attorney's office, which was not a fun process. We needed to collect cell phone numbers from clients. Nobody did that before, nobody asked in the county. And then we needed to integrate with their legacy data systems. So I think what's most interesting to me about this kind of burgeoning world of infographics and data science, and I want to call out one thing you said, which is moving from, what'd you say? Something to personal. Population to personal. I feel like in the same way, most of our data visualizations are cool but useless. They're too abstract and too macro, and I think we can use all of the same tools and principles to document the experience of people as they go through these systems. And documenting those experiences are closer, they give us more levers to actually make change. So thanks.
So we're really, really tight on time, and yet I know, we've got great experts here, and I want to tap into them. So I'm going to start out with one question, just one from me, and then you know, we're going to get through the audience as soon as possible, and then if the panelists can, if you have the answer, you know, I'll answer that if you can let us know. Then we'll try to squeeze in as many as possible. So we were concerned in the very beginning because we had disparate, you know, kind of panelists, but actually it all comes together that we're talking about huge data and then bringing it to the individual or making lives easier for some people. So what are some hints that you can provide to in seeing the audience and the kind of work they do to think about when they have data? When we're talking about big data, it's not just one thing, it's like million, how many million did you say, Will? 160 million data points. So how do you, what are some hints that you have to bring it to the individual?
I think that the key issue is that recognizing that for the individual, they're living their lives on a day-to-day basis, and they're not predisposed to evaluating your data. They don't have the time to walk through the context, where it came from, and you know what trying to rationale you're trying to make in a very short amount of time. So it's your job to actually lead them in that pathway, to prime them for what they're seeing, to lead them along that argument, and give them some sort of action afterwards. Okay, seeing something that's pretty and nice, that's great. Okay, but tying to some kind of pathway that they understand, that's relevant to their lives, I think that's the key to visualization.
Thank you. Anybody else?
Yeah,
Yeah,
so
Michelle.
one of the things I would say is it's about putting the data back in the hands of whoever the data is about, and then providing them, in our case, with facilitating the sort of cracking that and hacking that data to come up with something meaningful as well, right? So for me, it's about that crowdsourcing piece, and it's about figuring out what tools will allow us to best do that, and then you know, and having participants, people directly involved, it would be myself included if I was doing that, then decide what to do with it and what's useful.
Let me add one more thing.
No.
So oftentimes you only have one opportunity to collect the data. So I think you should make the most of that opportunity and get good data, get it nice and clean if possible. But dirty data is better than no data too, right? So always just get the data. And I think, you know, to Jacob's presentation is that if you you want to just collect, you want to have good data, because otherwise you can't really do anything with it. If you don't have the cell phone data, you can't send them a text message, you know, so try to get it. And then if you're more sophisticated, you can add like automated data collection mechanisms that automatically grabs their geolocation or something like that, and that can help tremendously as well.